over the ear like that? Okay. Gotcha. The only thing, so then when I'm done, I don't have to, right? I just hit stop streaming. Yeah. Okay. Okay. Okay, I think I got it. Thank you. Hello. How are you? The only thing you need is a yoga mat, and we're going to use the black ones. Yes. Oh yeah, it's not. right, we will get started. I'm going to have you guys all stand up. For those of you who don't know me, which I know most of you, my name is Carly King. I am the physical therapist assistant here, just right over there at the SEL Health Clinic. I am super excited to teach this class. My goal for you guys is to be able to learn how to properly engage your core. So this isn't going to be a class where we're just doing lots of crunches and sit-ups. We're really going to start from the very basics and work our way into some harder exercises. So first thing we have to go over is how to activate your pelvic floor and your transverse abdominis. So a little bit of an anatomy lesson. Your transverse abdominis is a deep inner core muscle that wraps all the way around your torso like a corset. So if you imagined you were wearing a corset and somebody cinched it up really, really tight in the back, it's going to hold everything in, and it's also going to help you to maintain your posture. When your transverse abdominis is engaged, it's going to help to support your hips and everything down your lower extremity and also up the chain. In order for your TA, transverse abdominis, to activate well, your pelvic floor muscles also need to be working. So your pelvic floor is almost like a sling. So if you imagine your pelvis is like a bowl or kind of like a bucket, your pelvic floor muscles act as a sling or like a hammock and help to hold everything up and in. And there's been quite a bit of research that has shown that when you can activate your pelvic floor, your transverse abdominis is going to co-contract with that. So it's very important. Now, quick show of hands, who has heard of a Kegel exercise? Everybody. Good. Okay, so they're mostly associated with women who are postpartum to re-strengthen the pelvic floor. But we are going to go over it real quick to help you learn how to turn on your transverse abdominis. So you'll hear me refer to it as a squeeze and lift motion. So the squeeze is going to be, if you imagine you were going to the bathroom and you had to stop the flow of urine, you would squeeze your bladder control muscles or squeeze your pelvic floor muscles to help stop that flow. So everybody see if you can get just a gentle squeeze. Think you got it? Okay. And then we're going to try a lift portion. So it's a internal lift up. You're thinking about lifting your sling. You can think about trying to like pull your bladder almost like up into your stomach. So that squeeze and lift is your Kegel exercise. And then you're going to let everything relax and try it again. Squeeze and lift. Questions with that? Think we got it? Okay, so now let's add in the transverse abdominis. So you're going to do the squeeze and lift, and then you're going to think about pulling your belly button up and in. You're bracing your core. So if you imagined I was going to come and punch each one of you in the stomach, you want to brace against that. So first start with your squeeze and lift, and pull everything in through here. Everything's just staying nice and neutral right through here. Do you guys feel it working through here? Now the goal is that you're really feeling this lower abdominal region working. So if you find the bony part of your hips. Yep, right there, good. And if you imagine there was a line going from one to the other, that's kind of where I want you to feel your transverse abdominis working. It's this lower abdominal area. So we don't necessarily want a ton up here, down here. Do we got it? Okay, so let's try and intensify this a little bit more. So if you, any downhill skiers here? One. Okay, good. So you're going to go into what I call a ski position. So you're leaning forward, not so much that you're going to fall over, but just this lean is going to help to automatically kick in this lower TA. Everybody feel it? So that's what you want to be feeling. Okay, do we got it? So main focus today is being able to keep this engaged with all of the exercises we're doing. In real life, you have to be able to keep your TA engaged with every movement you do. So walking, squatting, lifting, cleaning, doing yard work, whatever. this needs to be able to stay turned on. So what I want you to do is everybody go to the back wall. We're going to practice just a little bit of walking with it. So face the mirrors. Good. So I want you to start with your pelvic floor squeeze and lift. Pull in your core. Now keep it engaged and just walk. You can, as you start walking, you can let the pelvic floor relax, but really focus on keeping your transverse abdominis engaged. And on a scale of 1 to 10, intensity-wise, it only needs to be on at like a 2 or a 3, not very much. And then turn and go back. And try and walk normally, maybe look a little bit on the stiff side. Okay, did it stay turned on for everybody? Yes. Okay, so one of your big homeworks when you leave this class is when you're walking around campus, home, wherever, this muscle is staying turned on pretty much all the time, just to that really low intensity. By keeping it turned on, your hip muscles are going to work better, which is going to help just functionally throughout the whole day. Okay? Now come back up to your mats. Yes. So we engage the pelvic floor to help turn on the transverse abdominis. If you were to keep your pelvic floor engaged and your TA engaged, you would just kind of like, you would walk like this, and that's not going to work very well. And we also, getting a little bit into the physical therapy side of it, we don't want your pelvic floor to be overly tight either. Really, we're just retraining your pelvic floor to help turn on your transverse abdominis. Okay, and once you can get to the point where you can just pull in your transverse abdominis without doing the Kegel or the squeeze and lift, by all means, just turn this on and go, and then you're good. Okay? All right, so now we're going to do squatting. So a little bit harder exercise. What I'll tell you from what I know with patients is that the lower people tend to go, the harder it is to keep this engaged. So I want you to be very cognizant of keeping the belly button pulled up and in, pushing the hips back as you squat, and really just trying to keep that same muscle. And if you have any lower extremity issues, you don't have to do this. You can go very small range of motion. If you have any, you can do it on the wall. Yeah. So usually when people if this starts to go out, let's say you're lifting something that's 20 or 30 pounds, and we've got good technique, and our core starts to go, and then we start to lift, our back is going to break, and that's going to put you in a very compromised position and potentially lead to a lower back injury. So, were you guys able to keep it engaged with the squats? Now, do you do that in normal daily life? No. So, another part of your homework. All right, come back onto your mats, and I'm going to have you guys lay on your back. Lay on your back with your knees up. And again, find that bony part of your hip and just kind of walk your fingers in, and I want you to sink in right here. Yep, just inside that bony part of your hip, the part that kind of sticks out. So from here, I just want you guys to be able to learn how to palpate your TA. So in this position, do that squeeze and lift again, and then start to slowly draw your belly button up and in, and you should feel a tensioning under your fingers. I don't want there to be a big muscle that bulges out and pushes your fingers out, but think of it as like you're putting on a fitted sheet onto your mattress, and you're just trying to pull everything tight so that there's no wrinkles. And do that a few times. So let everything relax, go through your squeeze and lift, pull your belly button up and in, and feel the muscle tensioning. And I'm just going to come by and double check that everybody's is turning on. Okay, do your squeeze. Yeah, there you go. And if you can't necessarily feel it, do you mind if I, there we go. If you can't necessarily feel the contraction, let everything relax. And if you feel the tension decreasing, you most likely have got it turned on. Do you mind? Okay. And good. There you go. You got it. You're good. It's a very subtle tensioning. Do you mind? And squeeze. Okay, I think, and then let everything relax. Yeah, there you go. Everybody's got it. Perfect. Okay, stay on your backs here. We're going to go over a pelvic tilt. So I want you, again, if you don't have to go through the whole squeeze and lift to get your TA to turn on, you don't need to worry about it. If you can get that tensioning feeling without doing the squeeze and lift, by all means, just do that. So from here, I want you guys to engage your transverse abdominis and then start to tilt your pelvis back. So you're thinking about trying to tuck your tailbone in between your legs, or think about bringing your pubic bone towards your belly button, using those lower abdominal muscles to control the motion. It's called a posterior pelvic tilt. You can also think about trying to kind of flatten your back against the mat. And do about 10 of those, really focusing on trying to get the motion from the abs. It's kind of like you're doing like a reverse crunch. Very subtle motion, just rocking back and forth. Any questions on this one? Feel pretty? Yeah, I don't want to necessarily say as flat as possible, but go that direction. We don't want to go too far one way. Good. Okay. So now go into that posterior tilt position, so where your tailbone is tucked slightly between your legs, core's engaged, and I want you to lift one leg just about 6 inches, just like a little march, about 6 inches off the mat, and then do the other one. So it's not very much, and you're working on trying to keep your hips very stable. So if your fingers are on that bony part of your hip again, you shouldn't feel too much movement because your core is nice and locked in. And you should start to feel that lower transverse abdominis working. Go about 20 more seconds here. And rest. Okay, questions on that? Because we're going to make it just a little bit harder. Feel okay for everybody? Everybody feel like they got it? Okay, so now we're going to move into more of like a modified dead bug. So you're going to come up into this 90-90 position here. So hips are bent at about 90, knees are bent at about 90. Your core is engaged. The goal is to keep that same posterior pelvic tilt position that we did with the marching, but it's a little bit bigger movement. So one leg is going to come, you're going to tap your heel down and lift back up. Other side. So your leg is acting as the resistance to your core. Again, really trying to focus on keeping your pelvis neutral, not letting it rock forward as your leg comes down. Go a few more and then we'll rest. Good, do one more. Perfect. And then come up. You're going to go onto your hands and knees. So from this position, we're still working on keeping our lower abdominals engaged. Now we've got gravity coming down on us in a little bit of a different way. So the gravity is going to want to pull our belly out, right? So we have to focus on pulling up and in. Your hands should be right under your shoulders, knees are under your hips, about hip width apart. I want you to sink down so that your lower back is actually going to dip. We're going to work on finding neutral spine. And from this low position, just come up a little bit more. Okay, good. And now we're going to go a leg and the opposite arm out, keeping the core pulled in. Hold for a couple seconds, and then come back to center and switch. Focusing on keeping that same neutral posture, lower abs pulled in. And go ahead and just look down at your mat so that you're keeping your neck nice and neutral. You want to think about from fingertips to toes, you're in one nice long line. It's hard. It's really hard. Good, nice. Good. Okay, we're going to go about another. What was that? Does it? Oh, bird dog. Bird dog. Oh, okay. Okay, we're going to do a couple more, and then we'll go back on our backs and go through it all one more time. All right. Nice. Everybody flip back onto their backs again. We're going to start with those small marches. So first, engaging your core from here. So if you need to do that squeeze and lift, do the squeeze and lift. Pull your belly button up and in. And then lifting about 6 to 8 inches off the ground. Focusing on keeping the pelvis level. Fingertips on that bony part of your hip. Trying not to feel too much movement there. Go a few more here. Good, and rest. And then when you're ready, bring legs up into that 90-90 position. Again, lock in the core, trying to keep the pelvis stable. And drop a heel down, pull it up, and switch sides. Remember to breathe through these exercises. Go about 5 more. And rest. Good. Roll over. Onto hands and knees. Start by finding your neutral spine. So hands under shoulders, knees under hips, dip the lower back, and then come up just a little bit. Pull your belly button into your spine. Feel the lower abdominals engage, and then leg and opposite arm come out. Hold for a couple seconds, and come back in. fingertip to toe. It's a nice long line. Trying not to shift your weight too much from side to side. Keeping the eyes down on the mat so that we're not cranking our necks. Do a couple more here. All right, and rest. Questions with any of those 3 exercises? You might start to feel it more through like your rectus abdominis, which would be that like traditional 6-pack muscle. Really like, and that's fine. We want a lot of the focus to try and be on this lower abdominal region because that's where most of us are really weak. And turning on that transverse abdominis it's the most important core muscle to have turned on because it wraps all the way around and helps to stabilize our hips. And it's kind of it's like this chain of events that if you have a weak core, you're probably going to have weak hips, and then that could lead to knee injuries, ankle injuries. Kind of you're open to a lot of different injuries. So we like to start with strengthening the transverse abdominis first. Throughout this class, things are going to get harder, hopefully. My goal is to teach you how to like properly plank and really engage your core instead of, just hanging out in a plank position where you're maybe a little bit saggy or a little bit of a mountain, but really being able to pull things in and then throw in a little bit of hip strengthening because I really think of the core as being hips kind of all the way up through here. Okay, so any questions? Okay, that's the end of your first class then, and I will see you next Wednesday. Practice walking. Yes, your homework is anytime your core is, anytime you're doing anything, really. Keep your core engaged, especially if you're squatting, you're lifting something. Make sure that this is pulled in. And if you guys have any questions, please feel free to email me or Teams me. Okay?